On December 31st, 4,570 new cases of COVID-19 were identified out of 12,700 tests. On January 1st, we identified approximately 3,323 new cases and completed about 9,450 tests. On January 2nd, around 2,059 new cases were identified out of about 7,100 tests, and yesterday we had 3,013 new cases identified out of about 8,200 tests. Our positivity rate over the past 4 days has ranged from around 28% to 36%. This is the highest positivity rate we've seen with any variant since the pandemic began. We know Omicron is highly transmissible. Right now, more than 1 out of every 3 people getting a PCR test are testing positive for COVID-19 with higher rates in Edmonton and Calgary. If you're feeling unwell, it's quite likely because of the Omicron variant. And this means it's critical to stay home until you're feeling better, even if you have a test with a negative result. Currently, there are 436 people in hospital with COVID-19, including 61 in the ICU. Sadly, since December 28th, 12 deaths related to COVID-19 have been reported to Alberta Health. I must also sadly report that one of these deaths has been confirmed to be in a child under the age of 18. As we announced in October, in the case of anyone under 18, we do not report a death until we've completed a thorough review and confirmed that COVID was either a direct or contributing cause. To balance protecting the privacy of the family with the public disclosure on this case, we can report the child was in the age range of 5 to 9 years old and had a complex medical condition. However, we will not be providing any additional identifying details.
We are very determined to ensure the reentry of schools for in-classroom instruction on the schedule on January 10th. It is so critically important for kids. There will be challenges. There will be teachers and staff who are on isolation because of the widespread nature of this variant. But I think there has been a significant change in the consensus across certainly North America, many jurisdictions that had suspended schools for in-classroom instruction for much of the past 20 months have realized in retrospect that it was a mistake. I'll just give you the example of New York City, which was one of the first and where you saw some of the longest closures for in-classroom instruction. And you'll see the comments from the mayor-elect yesterday about his determination to ensure that the schools operate. That's the case broadly across Europe. It has been certainly consistent in Western Canada. We have sought as much as possible to keep schools open for in-classroom instruction. The science is in now. We know that in-class transmission has not been a significant problem. We know that that COVID poses a radically lower risk to the health of children than it does to adults. We know many of the key tactics to help operate classrooms safely. We're investing significantly in that. Over $40 million has been spent by Alberta school boards, supported by Alberta's government, on improving their ventilation and air quality systems. We are providing upwards of 10 million medical-grade masks for students and staff. We are making rapid test kits available to the schools, of course, for every student in class, to give their parents an additional tool that they can use. There are a wide range of protocols in place for school boards to operate schools safely. So there will be challenges, there's no doubt about that. But we want to do everything we possibly can to keep the schools operating for in-classroom instruction, because we believe it's in the best interests of the overall well-being of those children. We'll be meeting tomorrow again as the Cabinet COVID Committee. We had 2 meetings last week to review the latest data, both here across Canada and around the world. We do know that Omicron is a significantly different variant than the earlier ones that we encountered in terms of the speed of it and the ease of its spread, but also it being much less severe on an individual basis. Of course, we are all concerned that even a very small fraction of people being hospitalized on a huge number of people who've been infected can put unacceptable pressure on the healthcare system. Those are the factors that we will be keeping a very close eye on as we continue to monitor that situation. I'll remind you that we have had I think stringent public health measures in place since the first week of September, which were further enhanced just before Christmas. We, as in the past, we regard restrictions as a last and limited resort, given the damaging effect that restrictions have on the broader health of society. We've seen that damage particularly experienced by young people, by youth and adolescents. We've seen it manifest in record numbers, I believe, of opioid overdoses, for example. And so we need to take on board the broader social health as we balance these things.